All right, so talking about diet specifically to cardiovascular disease, this is the area that we have the ability as dietitians in the community to really make the largest impact. There is nothing more amazing than when you're working with a client, working with a group of people, providing education, and you see them, you're following up with them, and they come back and they say, "Hey, look at what happened. I changed my diet. I've been following what you said, and my cholesterol has lowered." That to me is our job right there. It's just the most incredible feeling knowing that you have helped somebody change their life and decrease their risk of having a heart attack or a stroke, which can be debilitating depending on how severe it is, or even can cause death. It's really amazing. So we're going to talk about how we get to change that. So there's two types of cholesterol that we can affect, especially with diet. That's our LDL, or our low density lipoprotein. So LDL, low density lipoprotein. This is going to be considered the bad cholesterol. Our bodies actually need LDL, but it's when it's in excess that is when it's damaging. Optimal levels for LDL is less than 100 milligrams per deciliter. You'll learn that at MNT. You're not required to know that number for our class. The other type of cholesterol is our good cholesterol, or our HDL. So our HDL is that high density lipoprotein. So this is the good guy. So high density lipoprotein is the one that goes in and cleans out that LDL. If we have our blood vessels, if LDL is in a high level, it actually starts to close our blood vessels. So if we have blood flow going like this through our veins, we start to get that buildup of LDL through here, then our blood flow is going to shut off and be a lot smaller. The risk for heart disease is extremely high when we have too much LDL, or plaque buildup. The medical terminology for this is atherosclerosis. Atherosclerosis is hardening of the blood vessels. So that's when that plaque is built up from too much LDL. So we can have too much LDL, and that HDL is going to come in and it's going to clean it out, so that will open our blood vessels back up. One way we can affect this is through dietary fiber. Fiber does this amazing job, especially soluble fiber. So soluble fiber is really slow going through our GI tract. Their beans and oatmeal are two high sources of soluble fiber. And what this does is the fiber and the cholesterol bind together, and then it's excreted out in our stools. So you are basically pooping out your cholesterol with that fiber. So it's a really, really amazing way we can do this. Another area of dietary is plant sterols. Plant sterols are found in like margarine, for example, canola oil. What that does is the plant sterol actually competes for the binding site of LDL. So the plant sterol will stick, and then that LDL is going to excrete from the body. But more specifically is the types of fat that we consume. So saturated fat has been shown to increase our LDL. And then trans fat has been seen to increase LDL and also decrease HDL. So it's increasing our bad cholesterol, and it's going to decrease our good cholesterol. So that's really a no-no. That's why the FDA has pushed so hard to completely eradicate trans fat from our food system, because they saw that direct correlation between trans fat and heart disease. So when we're counseling people who have high cholesterol, our best piece of advice is to limit saturated fat, completely exclude trans fat from your diet, and then increasing your fiber. Those three nutrition nuggets for decreasing cholesterol have been shown to be extremely effective for somebody who has high cholesterol. Now, other parts of dietary-wise is going to be alcohol. Excessive alcohol actually increases our risk for heart disease, and there are several studies that show that one alcoholic beverage per day can be beneficial. What this is a 12-ounce beer, 1 ounce of hard liquor, and then 5 ounces of wine. So 1 drink for women and 2 drinks for men per day have been shown to be cardioprotective. After this point, it loses its effectiveness and it really increases your risk of heart disease. A lot of the times people lose that portion size. So they maybe are pouring a bottle of red wine and they get a little heavy-handed. Now they're drinking 7 ounces instead of 5 ounces, and that chronically over time is not going to be beneficial. Other areas is smoking. Smoking increases LDL significantly. So we want to make sure as dietitians that we address all these areas, especially if we're working with a group of people who have heart disease. As dietitians, we're more of a lifestyle educator. We want to encourage them to stop smoking, to limit their alcohol, and to improve their diets. Yes, diet usually is first in our mind, but we need to consider these other areas of life. Another area would be stress. Stress shows its increased risk of heart disease. We want to work with patients and ask them, how much sleep are you getting? Are you really stressed out at work? Do you have a way to relieve that stress? All of these are areas that we want to address with our clients and in the community. We don't want to get fixated just on nutrition, even though that is our main goal here. Physical activity is another one. People who have sedentary lives aren't going to have as healthy of hearts. Our heart is a muscle. It's important to work out our muscles, so it's important to get that cardiovascular exercise in. So we need to make sure that we're encouraging clients to work out for at least 30 minutes, 5 days a week, at a moderate to vigorous level as well. It's not just a leisure walk. We need to make sure that those hearts are pumping really, really well.